Welcome to Arise News News Channel Global Briefing on COVID-19, the pandemic. Over the next 3 hours, we'll take an in-depth look at the deadly global crisis that is redefining the way we live and work. We have top experts standing by to share their thoughts and advice.
Alex, Lightman, if we were to bring you into this conversation here and slightly change gears, we know that there have been massive layoffs. There have definitely been closed companies and establishments. People are out of work and desperately in need of financial assistance. What do you say to the state of the economy now as we're battling this COVID-19 virus?
Well, this is the most expensive problem that we've ever experienced. We have the example of influenza, the Spanish flu, so-called, around 1918, 1920 or so. And that hit us pretty hard, but we weren't as globally interconnected at that time. And we didn't have so much spending on healthcare. A lot of people were used to taking care of themselves, used to having their entertainment, being with their family. You had grandparents and parents and children all in one home or a household or extended household. And now we're a lot more fragmented, a lot more people living alone, a lot more people living with just pets. And so we have had three big problems economically at one time. The first is a supply shock. All of a sudden, the ships stopped moving things between countries. The second thing is a demand shock. Probably 80% of industries have experienced something like a 50 to 80% drop. We've never seen anything like that in history. And the third thing is a market shock. All of a sudden, people are panic selling stocks and they're looking for a flight to safety. And meanwhile, the dollar is the reserve, US dollar is the reserve currency, and there's a dollar liquidity crisis. So there are over $3 trillion of loans made outside of the US where the repayment of the loan is required in dollars. And now the dollar has shot up in value. It's shot up against virtually every currency except majorly except for the Japanese yen. I was looking at a chart. It was up against 14% against the Mexican peso, for instance. So if you're in Mexico and you have a loan that you have to pay back in dollars, all of a sudden your loan cost is 14% right when your income is down. So we have these three crises, and it's very hard to unwind them. And then we have a kind of a fourth crisis, which is that people are not being given all the information that they need to survive and to take care of their own health. Because we hear that the medical establishment, hospitals, will be overwhelmed, and there are many things, which we can talk about right now if you'd like, that people can do to look out for their own health if they cannot access a hospital. I have a lot of faith in Nigeria. I've seen the movie 93 Days because Nigerians have seen this movie before. Everything that Nigerians learned, and especially people in Lagos, in dealing with Ebola, about washing your hands, not touching your face, not going near people who are infected, you have an advantage. You have a psychological immunity because you've seen it happen before, you've gone through the panic, you've gone through this feeling of terror, which itself can put someone in the hospital, and you've come through on the other side. So I think that the way that Nigeria handled your cases of Ebola in 2014, just remember the lessons, remember what you did then, because you solved that problem. The United States has not had this problem for 100 years, so while everybody in Nigeria who's an adult knows what to do, almost nobody in America knows what to do. The single biggest thing that people are not doing, that they need to do, is to wear a mask. And the societies where mask wearing is normal and people do it all the time, Japan and Korea, Singapore, Taiwan, those societies have a much lower rate of infection. And I would just add to that I would say that people should be doing stinky masks. So this is a paper towel, and on it I have put clove oil and I put thieves oil. So there are things that have antiviral properties that you can put between your breathing system and the mask, which can increase the effectiveness of it, at least in my opinion.
Just briefly, I want you to give us a bit more information on the fact that some countries have handled this crisis in the right way. I know that you've said that Nigeria has been making positive strides, but if you could expand on.
So I have a Nigerian friend. I talked to Jutta Amate. He's a director. I hear that he's well known in Nigeria. And we had a conversation about this yesterday. So I guess I'll say what Nigeria is doing right. The president was absolutely correct to have this 2-week lockdown for the most populous areas where people are interacting the most. That's exactly right. Stopping traffic between neighboring states. This is very smart. And you're also smarter than the United States because you're doing this a lot sooner. We had to have thousands of cases before we started doing lockdowns in the states. So the states and the cities are leading. New York, California, Washington State. We have in the United States right now, as we are talking, 135,000 cases. In Nigeria, and we still don't have a nationwide lockdown. We still don't have a federal lockdown. In Nigeria, you're having the most affected areas when you have fewer than 100 people. That's incredibly commendable. That's very smart. And what you're going to do in Nigeria and in African countries that emulate the policies of your president, who's well informed, is that you're going to slow the RO. You're going to slow the spread. And the problem is that this is a gain of function virus. Viruses have been around for 1.5 billion years. And they have, we have still not really gotten serious about dealing with viruses. 70% of the people in the world have herpes simplex 1, which is a virus. And there is a treatment for that, which everybody should have taken by now and gotten rid of it. 70% or so of the people have cytomegalovirus. Again, that has no symptoms, but these things have a viral load. So overall, what I would add to the policies that have been talked about before is not only the separation and the isolation, and Jutamate is saying that he's isolated in a hotel in Abuja, and that basically I checked with him, and the kind of things that are treatments that are needed for these are available to people in Nigeria, some of them at low cost. So I think that that it's important for people to get inhalers with albuterol. I think that people should get things that are called a nebulizer. Basically, if they have to have an emergency kind of situation, you should have antiviral things like eucalyptus, clove, rosemary oil, and you should have those oils near your nose in a little cloth. You might look, if you can Google this on your phone, but you might see that during the Black Death, during the plague, there were people walking around with these scary-looking bird masks that had long noses, and those noses were there for a reason. They were filled with rags that were soaked in rosemary oil and clove oil and other kinds of oils that have antiviral properties. So the main thing that you can do at home is to think, what can I do to reduce viral load on my body? Because any other virus you're dealing with, if you're fighting off herpes simplex 1 and cytomegalovirus, and then you get COVID-19, which is based on the virus SARS-CoV-2, you want to reduce the distraction of your adaptive immune system and your innate immune system. You don't want them fighting multiple viruses. Also, you want to take a lot of vitamin C. You can take vitamin C up to the point where you have diarrhea, and you might go, oh, diarrhea is bad, because that's associated with Ebola. But that's the one thing that you shouldn't be terribly afraid of. You can spread through fecal oral channels, but it's good to have to go poop all the time, because that's a way of getting rid of viruses that are in your intestines. And the problem with this SARS-CoV-2, that causes a condition, COVID-19, is that it attacks not only the lungs, but it also attacks the liver, and it attacks, to some extent, they're saying that it attacks the heart.
Alex, I wanted to ask you, what is the role of data, mathematic modeling, and science in preparing for pandemics with regards to how one could possibly, although this is being called a black swan event, one could possibly prepare for something like this with regards to the effect on an economy?
Sure. Nassim Taleb, the guy who wrote the book, The Black Swan, says it isn't a black swan. We can expect to have more of these because we have scientists all around the world doing gain-of-function research where they use serial transmission of diseases through animal reservoirs like ferrets and bats to make diseases that are more contagious and are more damaging. And this is the result of some of that research. And the fact that these same gain-of-function scientists are now outgoing and not even talking about their work and trying to say there's no man-made origins means we haven't learned the lesson from this at all. The second thing is that I've heard President Trump say nobody could predict this. In fact, many people are predicting this. Bill Gates has a 2015 TEDx talk or TED talk in which he's predicting exactly this. And then there's the Agenda 201 conference that predicted exactly this. So I could actually name over 50 people, if you needed me to, who predicted exactly that this would happen, this kind of pandemic, and most of them even called it out as coronavirus or avian flu or SARS, those kind of things. So viruses have been around for 1.5 billion years, and as I was saying before, we haven't really come to grips with viruses. But and we also talked about before, to bring new viewers of Buhari'S up to speed, this is a demand shock, this is a supply shock, this is a market shock, and this is an information shock. So we all need to get up to speed about viruses, about contagion. And as I was saying before, Nigerians and Africans have an advantage because they did a great job in stopping the Ebola outbreak that happened, stopped it cold. And I have also, this is the disease more than any other that I've ever heard of that attacks the elderly. The median age in Nigeria, as we just discussed, is young. In fact, I'll tell you what the number is. The median age in Nigeria, so that age, people are, half of them are younger than that and half are older, is 19.7. So Nigerians have a whole superpower, which is a young population. And Africa is pretty similar to that. The average life expectancy in Africa is 61 and 65, 66 for women, depending on which statistics you look at. And these are not the groups that are most at risk. So Africa should come out of this much better than might people. So there's no reason for Africans to panic. Your youth is one of your strengths as long as you stop your socializing. You can't fist bump, you can't shake hands, you can't hug, you can't kiss. You just have to be cold, which, because Africans are often in general so warm and so communal and so friendly to each other, you have to change your mindset and be more cold. Think of Swiss people, or Swedish people or something. You have to be colder than normal. And as far as economically, my estimate is that the U.S. GDP will take a 10% hit. So the world economy is around 86 trillion a year for gross global product, and the U.S. is about 21 trillion a year. So we're going to do about 2 trillion less. We're going to have a lot fewer restaurants open, movies and all that. And the service economy in the United States is between 70 and 80%. And the service economy, people serving people in close proximity, that's going to be dead in America for at least the next 3 months. Now, one of the big things that we have to look at and you have to think about is how much money do you have in your corporation? How much money do you have at home? And if you have less than 6 months, then you have to stop spending money as fast as possible, because this will last a long time. You have between 6 months and 12 months, you have ability, and if you have 2 years or more, you're in great shape. But basically, everybody should sit down with family, everybody should sit down with employees and do a survival plan. So I'm the CEO of Kimoji.com, and we have I have 22 people working for me. We make software that helps track people and helps them protect privacy and security. And we're going to be shifting people over to working on how you can basically have credentials and say, look, I don't have it. See this? I can go into this place. Or I have had it and now I'm cured and I have the antibodies, so I can't get infected. So we need to know who's had it, who hasn't had it, and who's had it and has no signs and can't infect others.